Hi all, I'm gonna be presenting about sexually transmitted diseases. Sexually transmitted diseases or STDs are one of the most infectious diseases in the United States. What are STDs? The technical definition of sexually transmitted diseases is that they are those types of diseases or infections that are transferred during sexual contact. How do STDs spread? Sexually transmitted diseases are transferred from one person to another through the exchange of semen, blood, and other body fluids. These diseases spread during sexual activity such as vaginal intercourse, oral sex, or anal sex. Types of organisms that cause STDs. STDs are caused by one of the three types of organisms. Parasites, they are tiny in size that they feed from the person they infect. Bacteria are unicellular organisms. They attach together to feed on the infected person. Viruses are complex molecules that multiply rapidly when they invade the cells of the infected person. Common STDs. Common parasitic STDs. Trichomoniasis. It causes painful urination for both men and women. Its symptoms starts to appear 5 to 28 days after getting the infection. Common bacterial STDs. Chlamydia. It's a disease that infects the urinary tract. For women, it can lead to pelvic inflammatory disease, which causes problem with pregnancy. For men, it can infect the epididymis, which is the tube that carries the sperm. This can cause pain and infertility. Gonorrhea. The bacteria that cause gonorrhea infect the genital tract, mouth, or anus. For men, it can cause pain when urinating, and if it's untreated, it can cause problems with prostates or testicles. For women, it can also cause pain when urinating, and if it remains untreated, it can lead to pelvic inflammatory disease that can cause problems with pregnancy or infertility. Syphilis. The bacteria that causes syphilis affects the genital area, lips, mouth, or anus, in both men and women. In its early stages, it causes some sores. If it remains untreated, it can cause skin rash on hands and feet. The sores formed by syphilis make it easier to get or give someone HIV during sexual intercourse. Common viral STDs. AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It's an STD caused by human immunodeficiency virus or HIV that destroys the human body's immune system. HPV, human papillomaviruses, are viruses that can cause warts. There are more than 100 types of HPV, but about 30 types of them put you at risk of cancer. Low risk HPV can cause genital warts, and high risk HPV can cause genital cancer. Genital herpes. It is caused by herpes simplex virus, HSV. It can cause sores on your genitals, buttocks, or thighs. STD symptoms. Most of the STDs have the same symptoms. The symptoms are sores on genitals or oral areas such as mouth or lips, painful or burning sensation during urination, discharge from vagina or penis, warts in genitals or oral areas, itching in genital area, foul smell from genital area, weight loss, painful sex, and many uncountable more. These symptoms are common between STDs, but many STDs do not have symptoms that are easy to recognize. Treatment of STDs. The, the treatment depends on the STD. If the infection is caused by a bacteria or a parasite, such as gonorrhea, syphilis, chlamydia, or trichomoniasis, it can be treated with antibiotics or medicine. If the infection is caused by a virus such as AIDS, HPV, or genital herpes, there is no cure for it. Medical treatment is used only to keep them under control or slow its progress, but in many times it can be unsuccessful. How to prevent STDs? These are some of the ways that prevent STDs, but many of them are not 100% effective. The use of male condoms can reduce the risk of getting an STD. Washing your genital area with soap after sexual intercourse as to flush away parasites and germs. Urinate after having sex. This could wash away some germs that entered the urinary system. For women, avoid having sex during menstruation. Women who have HIV are more infectious, and women who don't are more susceptible for it during this time. Avoid anal intercourse. The rectum and the anus contains a lot of germs that can cause STDs for both men and women. If you are sexually active, have regular medical checkups for STDs, even if you don't recognize any symptoms. Shocking facts about STDs and college students. Some statistical facts for SJSU students from health testing centers about sexually transmitted diseases. College students get nearly half of all new STD cases each year, and quarter of them already have an STD. The most common STDs among college students are HPV, chlamydia, and genital herpes. 15 to 24-year-olds account for only 25% of sexually active Americans, yet they make up 48% of all newly diagnosed STDs each year. Young women under 25 years old are more biologically susceptible to STDs than other women, than older women. Tho- those statistical facts are shocking, and the rate of STDs is increasing at an alarmingly rate among college students. The sources that I used in conducting this research: the U.S. National Library of Medicine, Mayo Clinic Organization, WordPress. In addition to those sources, I used JSTOR for additional information about STDs. You can also find more results by simply typing sexually transmitted diseases on any search engine such as Google, but make sure that the website you are browsing is reputable and reliable in reviewing the author's name, the date of modification of the website, who reviewed it, and all the stuff. Thank you for your time, and I hope that you guys developed a better understanding about these kinds of diseases and how to prevent it.